Hello, my name is Jenny Archer and I'm the librarian at Sandburg College. Welcome to Evidence-Based Practice Research for the Health Professions. I'm so glad that you've joined us. So today during our workshop, we'll talk about a couple things. We'll talk about asking good research questions and how to find appropriate sources to help you answer your research questions, because different types of questions require different types of resources. So before we get too far, let's talk about what evidence-based practice is. So basically, evidence-based practice is a research method that integrates the best research evidence available with clinical expertise and good patient communication to help health practitioners make informed decisions. And this is really important because back in the day, practitioners were only making decisions based on their personal experience, different kinds of anecdotes of things that they had heard, and just the way things that had always been done. They weren't necessarily always considering, clinical research and what was being done in the field, or information about the patient, their lives, good patient communication, things like that into account when they were making these decisions. So this is basically a method that combines, patient communication, clinical expertise, and published research in the field to really make the best decisions available. So why is evidence-based research important? Well, first of all, for every 3 patients seen, 2 questions are generated. And we all know that when medical professionals are meeting with patients, there's often not a lot of time to meet with each patient. And sometimes because of a lack of information resource or weak search skills, sometimes those questions aren't necessarily being answered during a patient visit or aren't necessarily being answered in a timely manner. So evidence-based practice can help you identify questions and find the answers to them more quickly in order to serve patients better. So when you find yourself in an evidence-based practice situation or in a situation where you're asking a health-related research question, it's really important to start by identifying what you know. First of all, what you know about the case, and second of all, what you already know, maybe about the condition or treatment or patient, and also gaps in your knowledge that you really need to fill in order to answer those questions. So here's a sample situation that we'll be working with throughout the workshop. So the situation is you've been approached to work with a local school district to develop an intervention designed to prevent childhood obesity. In researching what approach to take, you've read articles describing a number of different possible interventions, but you're not certain as to whether an exercise program or a nutritional educational program would be more effective with your population. So given this scenario, what question would you have in response to this case? And take a second to think about it, pause the video if you need to. Just think about what question you have. Okay, so basically there's 2 major kinds of questions that you might ask in an evidence-based practice situation, or really any kind of working with a patient kind of situation. So the first is a background question, and background questions focus on, the 5 W's and H: who, what, when, where, why, and how. So these might be questions like, what are the symptoms of mumps? How do I treat heart disease? Who is the best candidate for this type of clinical trial? They're kind of straightforward background kind of questions, just to get the basic information about a condition or about a situation. On the other end of the spectrum, we have foreground or Pico questions. And these are going to be more complex, and they'll usually include the 4 elements of Pico listed below. So those tend to be, who is the patient? What is the patient's disorder or disease? What is the intervention or finding under review? What's the comparison intervention? And what is the outcome? So those 4 questions or points make up one more complex question that you can ask in order to get more complex or sophisticated answers to your questions or the situation. So think about this for a second. Did you write a background question or a foreground question to our scenario about childhood obesity? Now, it's important to think about this because you use very different resources to answer background questions than you would to answer foreground questions. And we'll get to that in a second. But for right now, let's focus on asking good foreground questions since they tend to be a little bit more complex. So one tool that I have to help you with this is the evidence-based practice research question and plan handout, and you can find this on Atomic Learning, and I'll give you directions for how to find it at the end of this session. But basically, especially when you're working with more complex research questions, it really helps to kind of break them down in a more systematic method, and this can help you make sure that you're including all the points as well as searching for the information in the correct places. So in this first box here, what do you know about the case? What details are important? I've included that scenario that you just looked at, like about being approached to work with the school district in order to develop an intervention. And then after you identify what you already know about the case and what the important details are, it's important to identify the core elements of the case using Pico. So identify who the patient is or what the patient's disorder or disease is. So in this case, the patient would be elementary school children. And I'm going to skip the disorder or disease part for right now since they may or may not have childhood obesity. It's just kind of an education program. Then we need to identify what intervention or finding is under review. And in this case, it would be an exercise program. And then what comparison intervention is there? So we're wondering what's more effective, an exercise program or a nutritional education program. Okay. And then finally, what's the outcome? What do we want to happen, or sometimes what do we want to avoid as a result of our treatment? So in this case, we want to reduce BMI or body mass index, or maybe body weight could be another way of putting that. Or we could also just say prevent childhood obesity. So of saying it, but generally the same gist of what we're trying to do. So once you've identified those core elements of the situation, you'll use those elements in order to write your question. And that gets into point number 3 down here. So consider the following as you write your questions. So describe the subject of the question. You can include any pertinent characteristics that maybe are important and could affect the outcome or the information you're looking for. So maybe you're looking for how a treatment works for patients of a certain age group, or maybe there's other underlying conditions that you need to consider, something like that. Also define which intervention you're considering for your patient and name a second intervention to compare it to. And then finally, define the outcome that you wish to assess. And when you're defining your outcome, focus on patient-oriented outcomes. And they can be things like death, disability, discomfort, because patients often care about those types of outcomes more than they would something like a lab result or something like that. And usually when you're answering those questions, you'll end up having these elements of Pico included in. And sometimes these elements will even become your keywords when it's time to search the resources that you can consult. So now that we've filled out part 2, and it's time to move on to part 3. Which of these do you think would be the best evidence-based practice question, or the best Pico question? So do you think it would be A, is an exercise program or a nutritional education program more effective in reducing weight in obese elementary children? Do you think B, will an exercise program reduce weight in obese elementary school children? Or C, is an exercise program or a nutritional education program more effective in reducing weight? Or D, Is an exercise program or a nutritional education program best for elementary school children? Okay, now that you've had a chance to think about it, the best answer to this question would be A, and that's because it has all the parts of Pico included. And you might encounter some research question situations where you might not have every part, but in this situation, we definitely had all those components of patient, intervention, comparison, and outcome. So we need to include all of those components. So in question 1, it has the intervention, the exercise program. It has the comparison, nutritional education program. It has the objective or the outcome, effective in reducing weight in obese elementary school children. We know the patient would be elementary school children. And B, C, and D are missing some of those components and are therefore not the best answers for this question. So as you do your research and you have your question, you'll need to decide what kinds of sources to consult. So when you consult research just on your own, where do you usually go first? Do you A, use your textbook? Do you B, use database articles first and foremost? Do you C, go right to the internet and start Googling something? Or D, do you look for articles that have already been reviewed by experts in the field? Okay, so when you do research in the health profession, you might have a different strategy for approaching research than you might, if you're doing research in high school or even for like your general education classes like English class or speech or something like that. A lot of times you might be told like, okay, make sure that you go to the databases first, make sure that you find, primary literature or just articles on your topic, or don't go to the internet or something like that. And those rules don't necessarily exactly apply when you're doing evidence-based practice research, because you have different needs as a healthcare practitioner than you necessarily do as a student. In healthcare, you need to find information really quickly, so articles that have already been reviewed by experts are really beneficial to you. And sometimes you'll find those in databases, sometimes you'll find them on the internet. So really you're looking for a certain kind of source more than, always go to this location or never go to that location in order to find it. So before we get into those kinds of sources too much, it is important to know that you have background information that you'll use for background questions. And background information provides more of an overview of a topic. And this is information that's usually found in like textbooks, reference books, sometimes on websites. But it's really important when you use background information to very, very carefully evaluate that information for currency, because it isn't always updated. So when you're evaluating for currency, try not to use the copyright date, especially if it's something like a book, because it can take a long time to write and publish books. So whether you're using, a book or a website or whatever, if your source is citing other sources or articles, which it usually will, it's really important to figure out what the dates of that information that are being cited in the background source are, because that'll give you a better idea of how current the information being provided to you is. So if it's something that's getting kind of old or dated, make sure that you don't use it. Make sure that you look for, the most current information you can on a topic, since things often change quickly in the health professions. Also keep in mind that you should only use background sources or background information to answer background questions. So especially when you're first getting started, you'll probably ask a lot of background questions because you're still getting familiar with different types of conditions and disorders and treatment methods and things like that. As you get more experienced, you'll probably start asking more foreground or Pico questions. But when you start asking more foreground questions, make sure that you use the type of research sources I'll talk to you about in a second rather than background information, because it's just not going to provide you with enough depth to really dig in there and get the information that you need to treat your patient. So that being said, when you do foreground questions or Pico questions that are more complex, the first place that you should go to consult resources are filtered resources. And those are resources that have already been reviewed and evaluated by experts to answer a clinical question. The best information is summarized for you already, which saves a lot of time and makes it easy to quickly determine what a source's strengths are, what its weaknesses are, and how applicable it is for patients, because somebody's already gone through and made some of those judgment calls for you. A research study that I found that was conducted in like the 80s, I think, mentioned that 75 trials and 11 systematic reviews are published each day. And if you were going to read all of those and really keep up to date with what was being published in the field, it would take you over 14 hours a day, even if you only spent 10 minutes on each of those types of sources. And I'm guessing that the number hasn't gone down any about the amount of information being published since the 80s. So it really is important to stay up to date, to use filtered sources where people are doing some of that information and, weeding through to find out what's best and summarize it for you, so you can get the information you need in a timely manner for your patients. So when you use filtered resources, do make sure that you evaluate it based on the resource's currency. If you're researching a topic that's really hot, that people are talking about a lot right now, that there's definitely a need for information on, that might not be a problem. If you're researching something that isn't as well known or doesn't affect as many people, it might be harder to find more current information, and therefore you would need to use different types of sources if there just isn't information or not enough. But before we talk about that, filtered resources come in different varieties, and I have 3 major ones listed here. There's lots of other types of filtered resources too, but a few that I've come across using some of the sources I'll mention are systematic reviews, and they use an organized method to locate, assemble, and evaluate the literature on a specific issue using a set criteria in order to critically assess and evaluate research studies on the issue that you're researching. Then we have evidence-based practice summaries, and these summarize research about a strategy or intervention and include information about the intervention's level of effectiveness with the target population. And then lastly, we have clinical practice guidelines, and they include recommendations for patient care based on systematic review of evidence and an assessment of the benefits and harms of alternative care options. So they have kind of different nuances of how they're filtered, but they all have been reviewed by experts. They all, pull out the most important information for you, whether it's in a summary or a guideline or something like that, to make it easy for you to understand and utilize that information quickly. So I'll show you one resource that I've come across that I think is really useful for a filtered source, and that's the National Guideline Clearinghouse. This is a freely available website that you can search. It's put out by the Agency of Healthcare Research and Quality. It's a government website, and it's representative of a few different search methods that are used by this type of website or this type of database. So you can do a basic search, just type in your search terms like usual, and that's pretty common. Every website and database looks a little bit different, but they'll have similar features here for you. So I could just do a basic search, or I can also do an advanced search. And this particular website is pretty nice because it gives you a lot of facets and limiters that you can use. So if I wanted to do a search for obesity intervention, I could type that in. I could decide, where I wanted the keyword to pop up in my search, but I'll just leave that wide open for right now. But then I also have other areas that I can limit my search by without using keywords. So, here, age of target population, well, I'm just looking for children, so I can click that there. I have other filters I can use, like maybe a clinical specialty, a method used to assess the evidence, a publication year, all sorts of ways that I can limit that result. And that's not available in every site, but it is fairly common and really useful when it's available. So I can click on Show Results. Okay, there we go. So once we get into our results, we can scroll through, we can look at titles, we can look at dates, things to help us evaluate. I've looked through a few of these already. So I'm going to open up this first one, Prevention and Management of Obesity for Children and Adults. That looked like it might be helpful for me. It's pretty recent, 2013. And once it opens, it has some nice tools in there that can help us out. It has the title, it has the source information I would need to cite it. It gives us, sections that we can jump to in order to find information quickly. It has different guideline classifications, related content if I needed it. If I scroll down, I can see different specialties, intended users, guideline objectives, who the target population is. I can see words are highlighted of things that I included in my search. And if I scroll down far enough, I can see that we're getting into some of these recommendations, and that toward the bottom here, getting into like 6 and 7, they're comparing like nutritional intervention, physical activity, things like that. So that would give me some of that information that I'm looking for. Okay, so that's one filtered resource. There are many others that you can consult. A few that I have listed on a handout on atomic learning, which I'll show you how to get to toward the end, our ADA Center for Evidence-Based Dentistry, evidence updates, and the last one is Cochrane Database of Systematic Reviews would be another site to consult. So sometimes that you might not be able to find a filtered resource on your topic, like maybe it just doesn't exist or maybe it isn't current enough. In that case, you would want to go on and search unfiltered resources. And these are going to be just straightforward journal articles and primary literature. So the types of sources that you were probably asked to use, when you were taking general education classes like English or speech or something like that, and go to the databases and find a scholarly source. That's the type of thing that you'll find here in unfiltered resources. So when you're using unfiltered resources, nobody's really gone through them and vetted them and pulled out the best ones or summarized them and, given you a summary of their best points that you can use yet. So you really need to be careful to evaluate the quality, the validity, and the applicability to your patient when you're evaluating these sources. And I included some evaluation questions on some of those handouts that I mentioned that are on Atomic Learning for you. So unfiltered resources will still give you good information, but they do require more time and expertise to consult. So it really is important to use filtered resources when you can, although they might not always be available, and in which case journal articles are okay to use. So just to show you how a filtered or unfiltered resource would work, an unfiltered resource might be something like ProQuest Research Library, EBSCO Academic Search Premier, Medline Plus, PubMed. So those types of sources would be unfiltered. Every once in a while you might find a filtered source in there, but for the most part you won't. So we can click on Advanced Search to get more search options, just like we did in the National Guideline Clearinghouse. And I'm just going to do an advanced search for childhood obesity, and I'll add my interventions in there to help narrow our search. I'll add exercise intervention, and then I want a third term, so I'll add a row. And I will add dietary intervention. And search. Okay, so this gave us a lot of results, 1,984. We could continue, refining our keywords and adding keywords if we wanted to try to focus that a little bit more. But it's good just to look through the results and see what we have. We do have options here where we can limit our sources more. We could limit it to scholarly journals of different types. We could limit the publication date. This has stuff going back to 1974, and we probably want something much more current than that. So we can, drag it over to maybe, let's say, last few years. And then we click on update. So that helps us out. We can also search by publication type. Document type might be helpful in some ways. If I click on more options, you have article, feature, general information, maybe a conference proceeding, case studies. Here's some instructional materials or guidelines. So some of those may or may not be useful for you depending on what you're looking for, but it can help you filter things out. So let's say I'm interested in this first one, a childhood obesity intervention developed by families for families, results from a pilot study. So maybe not in a school setting like I'm looking for, but it's a good place to start. So once my page opens, I will see the title, I will see the author's names here, I'll see the title of the publication that it was published in, the volume number, the year it was published, all that information I need to cite it. And then here's the actual full text of the document. So it gives me some things to help me out, like an abstract that pulls out the background, the methods, the results, the conclusion. It has keywords, and I can just scroll down and read it. If I wanted to save this and use it later, I could always use some of these tools here on the side, like email it to myself. I could print it, I could download the PDF. So I have some options there as to how to access it as well. So basically the main takeaways from this presentation are, when you're doing research, it's important to identify what you need to know, so you have a good idea what you're looking for and where to find it. Once you identify what you need to know, you need to frame it as a question. And sometimes you'll ask background questions, especially as you're starting out. But as you gain more experience and work on more complex cases, Pico questions and Foreground questions that are more complex will be really useful for you. And you'll probably find yourself asking more of them. Sometimes creating a research plan and developing a research question using the handout that we use can help you make sure that your questions have all the required points in them. But when you go on to answer your questions, make sure that you carefully evaluate background information and that you only use it to answer background questions. And that when you're answering Foreground or Pico questions, that you either use filtered resources, or if filtered resources aren't available, that you use unfiltered resources rather than background information. So if you need help finding examples of filtered and unfiltered resources or ways to evaluate your sources, make sure that you go to Atomic Learning. You can get to it by clicking the link on My Sandburg, and click on My Campus Training. And from there, click on Carl Sandburg College Library. And this will take you to resources about the library in general, as well as any resources that we create for workshops like this one. So this one is evidence-based practice, research for the health professions. I can click on that, and that'll give me a handout as well as the evidence-based practice research plan, where you can get more information about these sources, the URLs for the websites, and just things that you might need as you do evidence-based practice research. So, that being said, thank you so much for watching. If you have any questions or if you need help with your evidence-based practice research, please stop by the library. You can call us, you can email us, just let us know, and we're happy to do what we can to help. Thank you so much. Have a good day.